These are some frequently asked questions regarding bariatric weight loss surgery. We hope you find this useful. Frequently asked questions about the consultant clinic appointment. Can I have my bloods done on another day rather than at the consultant clinic? It's not ideal to have your bloods done prior to your appointment, as they may not have been requested, and also we would like the consultant to assess you to feel whether surgery is appropriate for you. If they feel you can go on to the assessment clinic, then you will be sent for bloods prior to leaving that appointment. Will I find out on the day whether or not I'm going through to the assessment clinic or being declined for surgical assessment? Yes, you should. The consultant will let you know if they are putting you forward for the assessment clinic. They will also inform you of any recommendations they may have from that clinic. Following your multidisciplinary clinic, we will then have a meeting and you will be informed of this outcome by telephone and then in writing. What will happen if I do not get to be seen in the assessment clinic? You will be discharged back to your GP, or you may be referred to another hospital for a consideration of surgery and a second opinion. Frequently asked questions about the surgical assessment clinic. How long will I need to be at the hospital on the day of the assessment clinic? The assessment clinic itself can take a majority of the day, as there are numerous appointments and various members of staff to see. You may want to bring provisions for lunch along, although there is a small cost of coffee and a WH Smith's on site. Can I bring somebody with me to clinic? Yes, of course you can. You may want them to attend all of your clinic appointments with you. You may want them to attend some of them or wait outside in between appointments. How is parking at the hospital? Parking can be an issue, but there are multiple car parks, so please ensure you arrive in time to allow for this prior to your appointment. You will not only be late for your appointment, but you may cause delays for others. Frequently asked questions following surgery. How long will I need to stay in hospital? Most patients only stay in for one night, but this may be extended if there is a clinical need such as vomiting. Will I be allowed visitors after my surgery? For most patients, the answer unfortunately is no, because you will be placed on the surgical short stay assessment unit, which is in very close proximity to the operating theatre and therefore is at risk of infection. You will be able to call them, you will be able to video call them when you return to the ward. How long until I can drive after my surgery? Normally this is a minimum of 2 weeks, depending how you feel after surgery, as you will need to obviously be able to do an emergency stop, and you won't be insured if you do it prior to this. If you are a driver for your job, you will need to check with your company and their insurance. How long until I can have a shower or a bath after surgery? You can have a shower the day of surgery. Most people wait until the day after they go home. You cannot bath for 2 weeks and your wounds need to be completely dry and healed. If you're somebody that likes to swim, we would advise 6 weeks until the wounds are well healed. My bowels have changed after surgery. Is this normal? Yes, this is quite normal. We have a lot of instances of patients having constipation. You may notice on the liver reduction diet that your bowels slow down because you're not having the fibre and bulk intake that you were having prior to this. And following surgery, it may be due to pain relief, reduced fluids. So therefore, we would advise you to take a preparation such as lactulose or Movicol, which you can get from your pharmacy, and make sure your fluids are increased as much as possible and aim to get some fibre into your diet. My GP won't give me a B12 injection or continue my lansoprazole. We put all the information on your discharge paperwork. Please guide your GP to this, and if there's any issues, let us know. Ideally, we would like you to have your first vitamin B12 injection prior to seeing us at your 3-month follow-up appointment. If you haven't, discuss it with the team members that you see then, and we can contact your GP. The lansoprazole will need to continue for 6 months. I can't tolerate my iron tablets as they make me feel sick. Try having a double dose every other day and changing the timing of the day. It may be that taking them all in the mornings or at lunchtime isn't right for you. There's no reason you can't take them in the evenings. I don't think I'm losing as much weight as other people. Your journey is your own, and other people may have different shapes, sizes, medical conditions. We advise you not to try and compare yourself to others, and if you're concerned, talk to a member of the team at your next appointment. I'm struggling with my mental health. Who can support me? So speak to your GP. There are services such as We Are With You for general talking therapies, and places like Cruise for bereavement. If you've had counselling or support in the past, we advise you to continue this during your initial surgical days. Thank you for watching this video. We hope you have found it useful.